Shoulder replacements are, like most of the joint replacements, an advance in orthopedics that give people back quality of life if they have lost their ability to do activities of daily living, getting dressed, putting on a bra, doing your hair, your makeup, feeding yourself, basic things, but also for more intense things. I have patients who've lost their ability to, play tennis or pickleball or golf. And when they can't do that, they've lost a good part of their life that they really enjoy. So I tell them, we can improve your quality of life, but we can also get you back the things that you really enjoy. So we have gotten to the stage now where we're actually doing them earlier in people's lives, because we say we want you to enjoy these replacements and do the things that you want to do, not miss out on those because of the fact that you're unable to do what you used to do 5 or 10 years before. So people ask me in the office, when I'm going to do a shoulder replacement, what are we doing? So this is a model here. So what I have in my right hand is basically part of the arm bone or the humerus. And what ends up happening is that you wear out the proximal humerus. So we take that part of worn out bone off, and we actually put, and this is an original version, a stem or almost piece of rebar in there with a new ball attached to it. And then that will then be placed against what is a new plastic socket, which gets cemented into what this would be, which is someone's shoulder blade. So then they smoothly glide around like a new ball bearing. Now, we do have other types of shoulder replacements, which I can show you. One we use called a reverse replacement that everyone asks about. And the way a shoulder should work is this is a bowling ball on a teacup saucer. And what holds it into place are the muscles themselves. So if somebody has bad muscles, they've worn away so much bone, what we'll actually do is we'll put a little ball over here, which allows us to put a much larger socket on this side. And that's what's called a reverse replacement. So I tell the patients from the outside, you don't really know a difference from, the incision and the surgery. It's just one works better with good muscles, one works better if they don't have good muscles. They're both good for getting pain back, but we're trying to get as much function back, and a little bit of that depends on what the patient has available for us to work with.